Hello, I am Dr. Spencer Galt, and this is a Society for Vascular Surgery briefing about practice settings. Congratulations, you are in the final stages of surgical training. You have successfully jumped through all the hoops. You have conquered college, medical school, residency, and fellowship. Now, at long last, it's time to find a real job. But what job? Up to now, each step in your journey followed a well-worn path. Set the goal, perform well, take the test, fill out the application, and hope for the best. Embarking on a medical career, whatever the specialty, takes relatively little creative thinking. The route is well defined. But as the end of training looms, you are faced with one final and very important decision. What type of practice setting is best for you? The days of trying to secure the best position based on external criteria are now over. Now you have to figure out what is best for you according to your own needs and desires. Arguably, this is the most difficult decision you are faced with in your new career. Because the hard part isn't getting what you want. The hard part is knowing what you want. So what are your professional and personal goals? To pioneer the next endovascular technique? To discover the signaling pathway that inhibits intimal hyperplasia? To run a small business? Or would you just like to practice surgery and leave all the other details to someone else? In short, what practice setting is right for you? Functionally, practice settings can be grouped into three broad categories: academics, private practice, and the multi-specialty clinic or hospital-employed position. As I go over each of these practice settings, keep in mind that the features among them are not mutually exclusive. Substantial overlap is invariably present. Nevertheless, there are significant differences that are real. If you choose an academic practice, you will find first and foremost to be expected to generate original research. It may be basic science, it may be clinical, or it may be translational, but research is what fundamentally sets academic practices apart. You will need to dedicate time on nights and weekends to your research, in addition to your clinical duties. Simultaneously, you will likely be expected to develop a clinical practice, unless you accept an appointment at an academically affiliated VA hospital. Should you opt for an academic job, I strongly recommend considering an appointment at a university-affiliated VA, especially if you are an aspiring basic scientist. The clinical practice will be established, your time will be more manageable, and you will have more available grant support. It is an advantageous place to establish an academic career. Regardless, an academic job requires you to answer to a division chief and a department chair. You will go through the promotions, retention, and tenure process, which can be anxiety-producing and onerous. You will be expected to teach medical students, residents, and fellows, a largely rewarding but sometimes vexing proposition. But for all of these efforts, the rewards can be enormous. A successful academic career will establish you as a leader in surgery. You can engender the respect of your peers worldwide. You can establish relationships internationally and influence the direction of the discipline. All surgeons owe our success to forward-thinking academicians. But what if academics is not right for you? What about private practice? Pure private practice models are out there, but they are becoming an endangered species. In days gone by, you could find a desirable community, apply for hospital privileges, open an office, and away you went. I'd wager that few, if any, vascular surgery practices have started that way in the past 5 years, though. If private practice is your goal, you will probably join an existing group. Most practices will employ you initially with partnership eligibility in a defined period of time, usually 1 to 3 years. You may have to buy in to the practice, so know what terms there are and what it is you are buying. You will need to learn about running a business because that's what you will be doing, and something in which young surgeons have virtually no training. You will need to know whether there is income sharing among the partners, or whether it's a so-called eat-what-you-kill system, or something in between. You will need to navigate the local political climate. The success or failure of the practice will depend solely on you and your partners. In today's medical industrial complex, maintaining a successful private practice is a formidable proposition. So why would you do it? Well, while physician autonomy in medicine is decaying by the day, private practice still affords it most. Decision-making can be done quicker and more nimbly in small groups. Bureaucracy is minimized. You will have more say in decisions that affect the practice, and creative entrepreneurism is still possible. Unfortunately, in my estimation, traditional private practice will be phased out within the next 10 to 15 years. But that does not mean that you should not pursue that goal if you desire it right now. As mergers and buyouts continue, your choice to go into private practice today could be very advantageous tomorrow. But what if academics is not for you, but you don't want to be bothered running a small business? A multi-specialty group practice or hospital-employed position might be right for you. While joining a multi-specialty group is not identical to a hospital-employed position, the jobs are similar enough that it makes them reasonable to consider them together. Most importantly, you will be employed by a large corporation. These types of practices are either pure employment or employment with potential buy-in. High-volume clinical care is emphasized. Publishing, while desirable, tends not to be expected. Business people will run the business, allowing you to concentrate fully on your surgical practice. Bear in mind, though, that when someone else is running the business, you are largely abdicating your autonomy. Decisions will be made for you by someone else, ideally in a representative fashion. Beware that some of these organizations can be very top-down in their approach, and you will be expected to do what the powers that be demand. Nevertheless, this type of practice setting is becoming increasingly common for those who do not choose an academic path, largely because there tends to be less financial risk. There also may be less financial reward. Of course, there are several well-known large healthcare organizations based on this model that have been cited as providing the most efficient, cost-effective, quality healthcare in the United States. There is a lot to be learned from some of these organizations. It is important to remember that although I have described these three basic models as discrete entities, there are many modifications within and among them. In every practice, there are individual variations in the way the business is run, the finances are managed, the referrals are generated, and so forth. The devil is always in the details. You must first define your own goals, then gather as much information about each practice as possible. Finally, make a decision and dive in and enjoy your chosen career.
This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.